On the American Health Journal, concussions in children, even mild concussions, can cause lingering symptoms. Doctors Sharif Taraman and Jonathan Romain of Children's Hospital Orange County explain what happens to the brain after a concussion.
Concussions are part of the spectrum of traumatic brain injuries. They're on the mild end. And what we see is from a concussion is the outward effects. The great thing about the brain is it controls everything. But the bad thing about the brain is it controls everything. And so when you've shaken the brain or you've caused it to have injury, we can see a variety of different complaints, both physical, emotional, and cognitive. There's a whole gamut of ways that you can get a head injury. Motor vehicle accidents are actually on the top. But when we think about recreational sports, bike riding, and competitive sports, football has been at the forefront of the ways that we see concussions. We see concussions in every sport though. Water polo, soccer, even scuba diving. Very strange ways to get a concussion. But any activity really can potentially cause a concussion, some more than others. Concussion can have a variety of symptoms, and they can be physical complaints from headache, feeling nauseous, dizzy, off balance. Oftentimes sleep disturbance accompanies a concussion, either having problems falling asleep, staying asleep, or maintaining a good sleep. We also see emotional dysregulation, and we can also see cognitive problems. So in our adolescents or young children, problems concentrating in the classroom, even reading, performing simple math may be difficult. With mild or moderate traumatic brain injuries, we do not see changes on imaging. So our MRIs, for example, or our CT scans don't show us that microscopic, that physiologic changes that occur after the brain has been shaken or there's a jar in the central nervous system. Time is the great healer. This is the great thing about concussions. If treated appropriately, they heal with time. And we do have interventions as neurologists or sports medicines, physicians, that we can do to help heal that process and make it faster. Rehabilitation has been extremely helpful in helping our young athletes and our young children who have sustained head injuries get back on their feet and get back on their feet quicker.
Dr. Romain explains traumatic brain injury cases he sees.
So we find that the recovery course for younger children tends to be a little bit longer. We find that with adolescents, they are also longer than adults in terms of recovery. And recovery, when I speak to recovery, it's areas of cognition and academics and physical functions. We find that in adolescents, there tends to be some issues relating to school functions and sports functions outside of the initial concussion that complicate the situation. Changes in neurological function can actually precipitate emotional issues. So we think of concussion and we think with regard to traumatic brain injury, there's a frontal lobe involvement usually. And so the frontal lobe is responsible for controlling emotions and regulating emotions. And actually it's more of the stop-start kind of thing. And so oftentimes what will happen is that regulation is not in place with someone who recently sustained a concussion. It's no longer working as effectively as it otherwise would be. So we see a lot of emotionality. We see things like irritability, short fuse, lower tolerance for frustration, those kinds of things. And those are a direct result of the concussion.
We know that the best way to avoid a concussion is to take some safety precautions. We do things like pitch counts in baseball to make sure that we don't hurt our athletes' elbows and their shoulders. We don't do hit counts in football. We don't do hit counts in other sports. And so I think we need to be, as a community, as a medical group, as parents, observing how often we're allowing, especially our young children, to be in situations which allow them to have head injuries. That's not to say that they shouldn't be playing sports and they shouldn't be playing football. But we need to think about when should we let them play? When should we let them play in a contact fashion? And how much is too much? Also recognizing the CDC has called concussions an epidemic in the United States. And it's not because it's a media frenzy. It's because these kids really do get into trouble if not recognized and if we don't take the proper steps to get them better and avoid those second injuries which can be catastrophic.